Hey there, this is Dr. Linda Burke, board certified OBGYN physician, blogger, and author of the prenatal book, The Smart Mother's Guide to a Better Pregnancy. So I want to talk briefly about third trimester bleeding in pregnancy because I heard a story from a colleague that really upset me because it involved a complication that should have never been. So this was a woman who was roughly in her 34th week of pregnancy. She had experienced some bleeding, some cramping, went to the hospital, was not seen immediately, was evaluated by a professional who was not a physician and told that she would have to wait to be seen. 2 hours later, this patient was finally seen, and it was determined that she had a placenta abruption and the baby died. Now, a placental abruption is a premature separation of the placenta from the uterus. Okay, it's an obstetrical emergency. It's like 911. You should immediately be sent to the back or wherever the delivery room is, and an ultrasound should be done to determine exactly what's going on. Now, what probably happened was this person who was evaluating the patient obviously did not think about abruption as a possible diagnosis. You do have bleeding in the first trimester. Quite often it's not serious, although there are some conditions such as an ectopic pregnancy, which is a pregnancy in the fallopian tube. That is an emergency. If someone is having a threatening miscarriage, that is an emergency, but it's sort of like wait and see. What they'll do is they'll do an ultrasound. They'll probably draw some blood to look at the hormone level, the pregnancy hormonal level. And if it's a certain amount, they'll monitor it again. But bleeding in the third trimester is 911. And because we are living in very uncertain times, pregnant women have to be extremely vigilant about what's going on, because you're quite susceptible to being a victim of a medical error. I'm just being quite honest with you. It is also a time that you need to, as often as possible, you need to have someone with you. You need to have either a partner or whoever's going to be with you, at the time that you give birth. And I know that's controversial because there are some hospitals who say yes, some hospitals who say no, but whoever, you need backup, in this pandemic. You need some backup. So try to never go to a hospital alone. So the other thing I want to talk about briefly is I know you guys are online looking at information for your pregnancy. The two resources that I highly recommend are Up to Date. It's called it's spelled UPTODATE, and it's the resource that we as physicians use, and they have a patient component. That is a very credible resource with the most updated information and very, very helpful. The second resource that I recommend is the ACOG resource for patients. Again, there is a section for physicians, but there's also a section for patients, and they have very, very comprehensive information about the COVID pandemic as it relates to pregnancy. So I just wanted to pass on this pearl to you. I hope you like and share, and I look forward to seeing you next time. Take care.